Good morning and welcome to this session on climate change and healthcare. Welcome on a very cold Davos morning. Well done for everybody who's braved the early mornings and managed to make it here on time. My name's Quentin Druell. I'm the Director of Circular Products and Materials at the WBCSD. And that's an NGO that works on sustainable development challenges with some of the world's largest organisations. This morning we're going to be discussing why healthcare must lead in climate mitigation. For the first 45 minutes, we'll hear from our esteemed panelists, and then we're going to open up the discussion to the online and in-person audience here. So firstly, let me introduce our panelists. Dr. Victor Zhao, President of the National Academy of Medicine, serves as Vice Chair of the National Research Council and is Chancellor Emeritus and Professor of Medicine at Duke University, having held previous posts at Harvard Medical School and Stanford. Robert Metzger, Philips Global Head of Sustainability, driving the corporate strategy towards innovation, sustainable business models, and embedding circular ways of working. Under his leadership, Philips became carbon neutral in operations in 2020. Pam Cheng is AstraZeneca's Executive Vice President of Global Operations and IT and Chief Sustainability Officer. She's passionate about developing talent, inclusion and diversity, driving innovation, and getting things done. Jens Nielsen, who is the founder and CEO of the World Climate Foundation. Under his leadership, the foundation has established an effective system for fostering collaboration amongst businesses, governments, investors, and civil society. And Farnaz Barouzi, Head of Pharma at Huma, a digital health AI company powering thousands of hospitals and clinical trial sites. She has a passion for solving healthcare problems with innovation solutions. So, just to kick us off on the discussion, we know some of the challenges that are ahead of us. The world is struggling to keep below 1.5 degrees of warming. And we know that for the healthcare sector, there are 3 interlinked challenges for the global population and the sector. Firstly, the direct impacts, the consequences of increasingly frequent weather events, such as droughts, floods, heat waves, which leads to respiratory diseases and temperature-related health effects. Secondly, the indirect impacts, the consequences of climate-related malnutrition, increased incidence of vector-borne and waterborne disease, such as dengue and cholera. And thirdly, the transition challenge. The healthcare sector itself is responsible for 5% of global GHG emissions. Getting to net zero is going to be a huge lift. And we know that the impacts of global heating will be felt most acutely by the most vulnerable sectors of society. So, coming first to Dr. Zhao, can you elaborate, please, on these challenges and explain why it's so important that the healthcare sector takes a leadership role?
Thank you, Quentin, and good morning to every one of you. 7 a.m., that's good enough for me. So in many ways, you've actually summarized, the issue that we face. And it's just wonderful now to say, finally, the world seeing climate change in the context of human dimensions. After all, when you think about what we're trying to do, we're trying to increase well-being, equity, and other issues. I think you have really articulated well the fact that it's really a public health crisis. If you look at the impact of climate change on human lives, as many as 20 million deaths a year related to climate-related events, and you already described many of them. Certainly air pollution is one of the largest, and we all know that, I think the latest IPCC said about 5 million deaths related to air pollution, and of course extreme weather, etc. So I think as a healthcare community, we have to shine a light on this. The good news is that in COP28, finally we have a health day. Someone says after 30 years of COP, finally people recognizing climate is not only an environmental impact, at the end of the day it's about human beings. So I think it's critically important. And of course, I think as a community, we need to find ways to communicate with the public, to allow people to understand that what's happening is not only about the environment or polar bears or even the grandchildren, but it's a crisis immediately. As you mentioned, it's also an equity crisis, particularly in marginalized community, indigenous population, and of course in poor countries. I think the other point you make, why we must take actions, because we actually are a major emitter. 5%, as you said, globally. If you add together US, Canada, UK, and Australia, the emission from the healthcare sector, it ranks about 5 or 6 as a nation in healthcare carbon emission. So we have to, I'm a physician, do no harm. And importantly, not only do no harm, but actually contribute well. I think this is where we're going to talk about many things we are doing, not only to reduce carbon emission, but actually improving health at the same time. So it's a public health crisis, it's an equity crisis, and really is squarely, in my opinion, sitting in our domain, which is healthcare.
Thank you. Thank you very much, Dr. Zhao. Well said.
Thank you.
And now coming to Robert, in terms of Philips' role in the healthcare sector as a manufacturer of healthcare equipment, what are the key sustainability challenges that you perceive?
Well, we are an integral part of the healthcare system, right, as a leading health technology manufacturer in the world. So building on what Dr. Zhao already said, the challenges are tremendous, and it's fantastic to see that in the climate community, healthcare is now on the agenda. COP for the first time here in Davos, and thanks for being here and amplifying that voice. At the same time, I think one of the challenges is to get the climate agenda in the healthcare community, right? And the leading people are here, but often you see also the tensions in the healthcare systems with the staff shortage, staff turnover. Half of mankind does not even have access to healthcare at all, 4 billion people. So there are so many challenges and burdens on the healthcare system that make it really difficult to get the mind space. If and as long we see climate change as something separate from the challenges, so I very much like the way how you put it, Dr. Zhao, these things are interconnected. So we need to find a way to find a health-centric approach to climate change that allows us also to bring all these different churches and beliefs, whatever, together and really join forces and do something. Now, what does it mean for us? We are one of the, as I said, leading health technology manufacturer. I think if we want to get an engaged discussion with healthcare providers, one of the things that they are concerned is very practical. It's operational energy efficiency. When you speak to a leading hospital chief operating officer, so they say, well, my energy bill is 100 million euros or dollar, whatever, in a year. Imagine that. If you can help them to save just 5% of that, the amount of cash flow that it generates, that you can use to provide more care or better care or further drive environmental performance or streamline care pathways is tremendous. So I think that's where this discussion should start. So with energy efficient equipment, helping staff to learn how to use it. But I think the next level is really to also address the huge amount of embedded carbon. All the equipment that is used, the energy that's used to produce that equipment needs to come from somewhere. So finding ways to work with global supply chains to really decarbonize global supply chains for the healthcare system is a huge opportunity, but a challenge, to your question, Quentin, also. And maybe the last one, it is really also the emissions and the levels that we see are tied to the systemic challenges. The healthcare system is very complex. Healthcare delivery is very complex. A lot of care protocols and so forth. So if you really want to do something about it, you need to find ways of that influence the way how care is delivered, basically, right? So to streamline care pathways in hospitals, to think about outpatient treatment and so forth. So there are a lot of opportunities. I would say challenges and opportunities are just two sides of the same coin that we see and where we would be happy to engage.
Yes.
Thank you very much, Robert. And Pam, I know those operational issues are very much top of your mind in your role also as operational lead globally at AstraZeneca. Perhaps you could describe some of the challenges that you see in moving towards more sustainable operations from a manufacturing point of view.
Absolutely. But if I can begin just echoing what my co-panelists here said, I think more and more now we are recognizing the climate crisis is the biggest, largest public health crisis of our time. I mean, it's impacting the most vulnerable in a disproportionate way, and it's becoming a health equity issue, right? The healthcare industry, as you've mentioned, you know, we are in the business of healing. We are in the business of helping people to be healthy. However, we are also one of the largest emitters of global emission. 5% of global emission are driven by healthcare sector, and believe it or not, it's actually bigger than the aviation sector. Right? So we don't think of it that way. So we have an obligation to act. And I think we have an obligation to come together to find innovation and solutions that includes two specific areas, in my opinion. One is, how do we come together, answering to your question around decarbonizing the entire value chain? And second, how do we really drive sort of better care, going from sick care to health care? Right? How do we have early screening, early detection, early treatment to make sure that we ensure a better patient outcome and keep the patients out of the hospital settings, which is better for the environment. In terms of, so I have global manufacturing and supply chain for AstraZeneca as well. I mean, we have a bold ambition. We have a $1 billion flagship program called Ambition Zero Carbon, where by 2026, our ambition is to become net zero for scope 1 and 2. To completely convert from fossil natural gas to renewable natural gas, if you will. I actually have one manufacturing site in the United States that's fully powered by biomethane, which is a great example. If we have more time, but we don't this morning, but it's a great example of circular economy in motion. So I think, in summary, you know, we know there are solutions. We know they can be scaled. The challenge is, how do we come together as a sector and beyond to really influence that change at scale?
Great, thank you very much. And that's a great segue into the question that I'm going to put to you, Jens, about, you know, the interconnectedness of issues. We know that systems thinking is required to solve some of these challenges up and down the value chain in the healthcare sector. What are the barriers, do you think, in the healthcare sector to addressing those interconnected challenges, and what do you think is needed to overcome them?
Thank you. First of all, I actually think that you can add the shipping sector to the aviation sector, and I think still health is emitting more than those two sectors together. But anyway, well, I see health. And first of all, I think it's great that health is now on the climate agenda. I also think it's great that the health sector is really taking climate change seriously. And I think that in the future, I also see health as one of the key drivers for the public and for the politicians to begin to look at climate or climate change and loss of biodiversity, etc. As something that we need to care about, especially in the way that we go towards the One Health concept, covering both the human health, animal health, and environmental health. So in terms of your question, I'd say that first of all, there's a high degree of complexity, organization complexity in the health sector, also compared to other sectors. You have a strong influence from governments, and you need reform from governments, and they're not the fastest one in reforming, I would say, in the climate space. You need finance, new types of financing, and today finance, you mostly find that in the private sector more than in the public sector, so you need to engage the private sector much more in financing new health solutions. For example, pension funds, as you mentioned, Robert, right, which has a clear interest in a better health for the future. And then I would say that you need business to come up with new solutions. You need a much broader set of engagement of different types of businesses, new technologies, for example. And then you also need the NGOs, because as was also mentioned here, much of the growth in terms of the health problems and also in emissions is happening in the emerging and developing markets. So it's very complex, the whole picture. And then I would say that You also have a lack of control. As far as I can see, more than 50% of the emissions in the health sector is coming from fossil fuels. And it's primarily residing in what you call scope 3. That's what the health sector as such, in a narrow sense, doesn't have much control of. I think that is one of your issues that you're dealing with, Pam. And so there's a lack of control of making change. So those would be the two major factors.
Thank you very much. And quite a revelation that the healthcare sector is responsible for 5% of global GHG emissions. I mean, that number speaks for itself, I think, and probably isn't top of everyone's mind when they think about major emitters globally. But I also want to pick up on the point that you mentioned, Pam, about prevention, and I think that's an interesting angle. And I'm going to come to Farnaz now, and many of us are aware of the benefits that data-driven solutions in healthcare can bring, detecting diseases early and better personalised care. But when it comes to climate change, how can we use data to address climate change issues, and what do you think some of the challenges are?
Great, and you touched on a very important point. So digital health solutions play like a double-edged sword. They are a problem, and they can also solve, and they offer solutions. And one of the challenges is that digital health solution deals with enormous and significant amount of data. And in healthcare, based on some reports and statistics, healthcare data contributes for about 30% of global data, which this is very significant, and this amount of data needs to be stored on clouds and needs to be analyzed, and we drive insights from them. Now, considering this huge amount of data being on servers and being on clouds, this plays a major role in developing carbon footprint. So I think one of the key challenges when dealing with digital health solution is the data part. Like, this is one of the key challenges. And how we can address that, I mean, there are definitely solutions, is making the cloud servers more energy efficient, more resource efficient, and by taking into consideration, as we're expanding and as we are collecting more and more data, by optimizing how we store that on clouds, we can play a significant role. But again, playing to the benefits of digital health solutions, I would like to also touch on some of the offerings it has, which is evident to the crowd. But we reduce a lot of the travel through our remote patient monitoring, so the staff travel, the patient travel, which minimizes the carbon footprint to a significant extent. By introducing electronic medical records, or EHRs, and streamlining and working in an evidence-based way to design care pathways, I think in a lot of ways we are reducing carbon emission, although healthcare sector, as everyone in the panel mentioned, is a great contributor, but I think digital health solution is playing a pivotal role, and the solutions we offer weighs out the challenges, but the challenges is mainly on the data as well.
Very interesting. And so the impacts that you can drive, have implications right back up the value chain in terms of lightweighting some of the care solutions that might need to be provided. So thank you for that. Great. So, I think we've heard and got a sense of some of the challenges, the scale of what's required. And to me, that means that, we need to set an ambition. The ambition for the healthcare sector needs to be bold. And maybe coming to you, Dr. Zhao, in terms of that ambition, where do you see the healthcare sector needing to set that ambition? And how do you think progress needs to be addressed and managed? And perhaps in your answer, you could touch on some of the work that you're doing at the National Academy of Medicine.
Thank you. My co-panelists, I think, have clearly pointed out this is a very complex issue. And in particular, I appreciate your comments, how complex it is. Nevertheless, I do think we need to take a step back and look at the whole issue from a more holistic point of view. So, for example, when you think about the areas that we're looking at, from health to healthcare, at least at National Academy of Medicine, we launched a grand challenge to say, what is the more comprehensive way of looking at this? There are at least 5 different areas. First is communications, We are the most trusted profession, and obviously we need to make sure that people realize this is a public health and equity crisis, so there's more public support. As you said, there's more policy support to address this area. Second, decarbonizing the health sector. This is where I think everybody has to come together. As been pointed out, supply chain is a really huge emitter, some 70% of the carbon emission of all health sectors, and therefore we really have to work with everyone. So one of the things we're doing, of course, is to create a collaborative that includes public-private partnership, some 200 organizations, AstraZeneca's participating, we're talking to Philips and others, to actually work together, not only in the care delivery side, but also in the manufacturing, technology, and supply chain, which is critically important. I think the third issue, of course, is research innovation. There's so much needed. I think the issue of data is so critically important, but we want to address the issue of equity. You really have to have the information of what, in fact, how are we affecting different communities, and what kind of interventions do we need, and how do we actually provide that information for policy making and decision making. The other one, of course, is what we call the transformation. Because after all, healthcare doesn't really exist in a silo. If you think about all the other industries, and we had an early conversation about the fact agriculture and transportation and energy and water all impact health and impact climate, and climate impacting them. There's insufficient knowledge of how these sectors are influencing human health. In other words, what I'm saying is agriculture, we spoke earlier, that they are making interventions in generative agriculture, you name it. But how is it actually directly affecting human health, right? You would assume that they impact them positively if you do the right thing, but there's not enough evidence. And of course, it's necessary that we get that evidence and look at how all sectors work together to impact human health, what we call a new economy, a well-being economy, instead of looking at carbon emission alone. And so those are some of the areas that I think, and of course equity, looking at low-income countries, different populations in the United States, marginalized population. So a lot to be done. I think we're going to likely talk about what healthcare sector can do, and I quite agree with my colleagues about the need to redesign our healthcare pathways, right? We've done things in certain ways. Should we not look at another way of doing things, particularly using digital health, virtual care, reducing carbon footprint, less transportation, prevention, as Pam said, that's critically important. Circular economy, how do we actually reduce waste in our own system? And it goes on and on. Of course, working with you, Robert, looking at technologies which we use. So lots of opportunities.
Thank you very much. And I want to pick up on one of the topics that you mentioned there, in particular with Robert, the circular economy topic. I know that Philips has got a supply chain of thousands of suppliers, and that the interconnectedness of those suppliers is tight. So how does Philips go about leading the change through its supply chain towards more sustainable outcomes?
Thanks, great question. And maybe to put that in perspective also, I think Dr. Zhao already said 70% of the emissions in the healthcare sector are outside the direct scope of the hospital. So it's in the supply chains, right? So it's important to address it. Secondly, why circular economy? If you look at the global emissions, about half of the climate emission reduction targets need to come from circular models. It's just the sheer amount of energy and carbon that we need to produce the materials that we then afterwards throw away in the linear economy that we have today that need to be addressed. So circularity and supply chains are really important topics. Also, supply chains are a way of building partnerships and scaling capabilities at a very effective way, right? I mean, you can get NGOs together, and that's fantastic to do that. But if a customer tells to a supplier, I want this done in a specific way. If a hospital articulates, I want to purchase only products from companies that are committed to science-based targets, that has a ripple effect that translates into the entire supply chain. So that's a very powerful way to build partnerships, exchange knowledge, and really drive change at scale. Now, what we are doing, I think you mentioned in your introductions, we operate carbon neutrally since 2020 globally. We have our own wind farms, solar panels, what have you not, use 100% renewable electricity. But we are sharing these type of insights on what took us to get there with our 15,000 bill of material suppliers. We were the first health tech company to adopt science-based targets for scope 1, 2, and 3, which means also the entire supply chain. And we are reaching out actively to our suppliers to get them to embrace science-based targets, because that is externally audited, transparent, right? Scientists are looking at what these companies are doing, and we are willing to share our knowledge and experience with our suppliers to get them on board. So 2.5 to 3 years back, we said we want by 2025 50% of our supply chain on science-based targets. Nobody knew whether that would be feasible or not, but last week I checked, we are at 47% today. Right? So there is movement in it, and I think that really will transform it. And circularity is, of course, a big topic of that, and there are many ways of collaborating, not just with the supply chain, but also, for instance, with the World Business Council on developing standardized metrics and methodologies with the circularity metrics. I think that's very important. We have been working with PACE, with the Ellen MacArthur Foundation on circularity. So there are many platforms where companies, NGOs, governments can exchange best practices and find ways to scale them.
Thank you very much. And then a similar question to you, Pam. You know, what do you think are the critical opportunities? And perhaps you can touch on some of the work that's been done with the PHSSR and elaborate a little bit on that.
Absolutely. So although the problem is daunting, I'm an optimist. I still think, despite many saying the ship has sailed, it's a bit too late, I think we still have an opportunity to mitigate. I think that's the first word come to mind when you ask me about opportunity. We have an opportunity to mitigate by decarbonizing and transforming healthcare pathway. And I think we, from a healthcare system perspective globally, many of the healthcare systems are overburdened, right? And we need to really adapt to the changing environment to make sure that the healthcare systems around the world are ready for today and tomorrow as well. And if I may give you a good example, I think, in terms of what AstraZeneca is working on, that kind of shine through on how do we leverage these opportunities to bring real change to the patient care. One of the examples is what we call the Project Opera. So this is, we partner with Scotland, NHS, and Glasgow University to transform heart failure diagnosis. So before the project, there were about 5,000 patients on a wait list for echocardiogram. And the average wait list was about 12 months. Now think about this, 12 months. This is a specific area in Scotland, right? And if you think about it, you're potentially delaying life-saving heart failure diagnosis that can save the patient. So together, working with NHS and the university and others, AstraZeneca was able to use what we call a handheld echocardiogram device, leveraging AI and machine learning that allows the initial triage in a primary care setting. So effectively, the primary care physician can determine which patients need to be sent to a heart failure specialist, thereby debottlenecking the limited number of heart failure specialists, and which was the root of the issue. And the best part yet was the wait time went from 12 months to 6 weeks. So, I mean, pretty amazing, right? And if we can replicate this
Unacceptable.
Absolutely. Absolutely. So if we can replicate this across multiple therapeutic areas and multiple areas, so we're now scaling this solution in many countries and more parts in Scotland, for example. So I think a quick example, a simple example on how we can all play a part in influencing the healthcare systems to adapt new ways of working. Lastly, on PHSSR, I mean, it's pretty amazing. This is something that that was launched actually at WEF with AstraZeneca and also London School of Economics, and many more have joined, including Philip, for example, and KPMG. And we've actually worked together. It's now in 30 plus countries, and we've developed sort of one of the largest sort of database body of work that really focuses on sort of evidence-based insights to help the policymakers of governments to drive more resilient healthcare design. So pretty amazing progress, and I think there's a lot more to do. And again, I'm an optimist, and I think we can make a huge difference if we come together.
Thank you very much. And just building on that theme of interconnectedness and collaboration, Jens, to come to you. Great example in the PHSSR of that happening. But what additional actions do you think need to be taken collectively by the healthcare sector? What additional mechanisms and forums do you think are required? And what's the role of public-private collaboration in achieving that?
I'll use three phrases or three objectives: sustainability, and opportunity, and integrity. So I'm also very optimistic, especially now that fossil fuel is part of the narrative of the Paris Agreement. Now we just need to do something about that. But that's if that is fixed, I'm quite positive for the climate for the future. But talking about sustainability. There is no quick fix for sustainability. I have not seen it. I've been in this business the business of climate change for 14 years. I have not seen any quick fix. It takes a long time. So you need this transition framework, and you need we need to, and the healthcare sector need, like other sectors, to move from a focus on tools to a focus on a transformative framework where everybody can work together on making the change year on year on year on year. And we need a narrative in sustainability to move sustainability up at the top level in the company, so it makes either governance sense or it makes business sense, etc. I think that's very important to move that up and work together in a joint framework. In terms of opportunity, there are other sectors that have focused more. Just if you take the energy sector, that's very fundamental to climate change, of course. I think there you can see an example of a strong focus on the opportunities that comes out of the risk and the change that we see, right? But I can also hear that there's a lot of thinking about new opportunities. How can you not only change what you have right now, but how can you look at digitalization? How can you look at new technology? How can you look at a focus on the patient, etc., etc.? And then that I think is a very important thing. And then thirdly, integrity, and that's where the whole collaboration part comes in, because it's very evident, as I said before, that you need reform, which often is across sectors what is lacking. I would say when you can see businesses moving across the board, also outside the health sector. You can see finance is moving, and you can see finance being seen as being used as a lever, both at the COP or at the EU, etc., to actually push business to move towards a more sustainable future. And I'll say you need that collaboration across government, business, and finance, and also civil society. And then you need to collaborate with in the health sector with other sectors. The health sector is very integrated in the whole city infrastructure, etc. So you need to look at it very holistically.
Mm-hmm. Thank you very much. I couldn't agree more about finance being a driver for change and creating that virtuous circle between disclosing sustainability performance of financial markets and then increased financial flows into innovation and technology. So I think that's a really key topic. So interesting one to explore. Just before I come to you, Farnaz, I'm just going to mention to the audience, both here in the room and those online, that we'll be moving to questions from the floor shortly. So if you do have burning questions you'd like to put to the panelists, please do start to think about those and prepare those. But coming to you, Farnaz, I think there's been some interesting discussion here about the role of technology and the role of innovation to drive change. Do you think innovation is happening quickly enough? What can we do to accelerate that innovation process to drive the kinds of remarkable impacts that Pam has described?
So I think, yes, the key stakeholders within healthcare are adopting digital health solutions, and the traction has been quite significant. But one of the key challenges, or I think one of the areas that could help facilitate and catalyze adoption of digital health solution is from a regulatory perspective. So we at HUMA, I would say we are one of the only digital health solution providers that have a disease agnostic license, meaning that if any pharma client or healthcare stakeholder comes to us and wants us to develop a solution for them, a platform, a software solution, we can do that instantly because we have FDA Class 2B and EU MDR Class 2B certification, which enables us to surpass that regulatory aspect. But I know that within this landscape, many of our peers have challenges acquiring that license. So I think if we could facilitate that from a regulatory standpoint, it would help adoption of digital health solutions. And the other thing that we've seen firsthand is adoption of digital health solutions through healthcare providers. I think there are not sufficient incentives for hospitals or for nurses and for physicians to take that up. But recently we have seen some monetary incentives being incorporated in the US, and it's a very interesting business model that in the US for certain indications, if clinics start adopting digital health solutions, and for each patient, if they can collect more than a certain number of data points, let's say 16 data points per month, they will be reimbursed. So for a clinic, for a small clinic, let's say, which has a certain number of patients, this is quite significant, and this is a great incentive for them to adopt it, because when there is a transformation, there are challenges and there are infrastructure transformation that needs to take place, and not everyone are open to it. So I think from a public and a private sector, we need to facilitate and we need to offer those infrastructures and offer incentives for clinics and for patients to adopt that. And I've seen that in the US. In the EU and the UK and other parts of the world, it has not been that eminent. So I think that would be quite key if you could introduce that. And I guess my co-panelists also touched on that within healthcare, we're going through that shift of moving from a reactive care pathway and treatment to more of a proactive through use of data and analytics, which I think we need to educate patients regarding this predictive analytics and also how we can optimize the care pathway. Because if patients who are our key end users are the advocates for this digital solutions, I think it will increase the pace of success and adoption of digital health solutions.
Thank you very much. Thank you. Very interesting. Yes, of course.
I think I'd like to make a few comments as someone who's directly involved with healthcare. First of all, it's very evident in this conversation that all parties in healthcare, the sector, should be involved. And the question is, how do we mobilize everyone? There's lots of good stuff being done by Philips and AstraZeneca and others, but clearly you need everybody, and in a more strategic, coordinated fashion, and not in just solving problem at a time. So that's critical. And of course, in our collaborative, that's what we do. We have both the Biden administration, industry, and academia, healthcare sectors, educators all together, trying to find solutions, learning from each other. There's so much learning to be done. The other thing is, by the way, Pam, 12 months to wait for an echo, that's totally unacceptable. You can never get that by, at least in the United States. I mean, but I think that's, so the area of, it's been discussed by Jan and many others, that actually healthcare sector in the delivery side is facing tremendous pressure. It's not that easy to say, yeah, go ahead and change these things. After all, they've got doctor shortage, nursing shortage, COVID-19 goes on and on and on. And so it's been said there's got to be incentives and financing mechanisms to enable this to happen. For example, one can imagine that in our collaborative, we have involvement of CMS and insurers. And they certainly talk about value-based payment with climate as one of the endpoints to give value-based payments. In the United States, we have the Inflation Reduction Act that allows hospitals and others to utilize that resource to do whatever improvement facilities, renewable energy, you name it. So I think it's really important to understand that the delivery side is not as easy as if you turn on the switch. You really need all the incentive and working all together to make this happen.
Thank you very much. So now opening up to questions from online and from those in the room. I can see a couple of hands. I'll be able to take probably 3 or 4 questions. So coming firstly over to this lady, maybe could you introduce yourself?
Hi, my name is Simi. I'm a primary care physician and also in health policy across the UK and in Lagos in Nigeria as well. Thank you for all your insights this morning. It's been amazing. I wrote a few things down and I'll just ask 2 questions very, very quickly. And I think you touched on it straight away just now about global healthcare workforce and the total disconnect between what we're saying here and actually what's happening on the ground. And the incentives are not just financial. There's so much more, and it would just be good to see how we're sort of combining this idea of climate change with almost sort of getting the healthcare force incentivized in a sort of morale boosting way, which is almost at zero, both across the UK and in Nigeria, where I'm from. So I'd like your insights on that. And then just secondly, obviously Africa is very, very, very missing from this conversation. And I know that you're probably all doing things with African economies. But for me, as someone who's very keen on developing healthcare access in Africa, it would be good to see what your companies are doing in that respect. And one of the things I'm doing at the moment is working with primary healthcare and also the diaspora healthcare workforce and building all this climate change incentives from the ground up. So it would be good to see how we can build on that and just make sure that equity globally is done, because you can't develop the West without developing Africa as well and other developing economies. Yeah.
Thank you very much. So
I can give it a start if you don't mind.
Yeah, absolutely.
Perfect. So thank you for the question. I think it's 2 fantastic questions. So if I can address them quickly, I think your first question around morale of the healthcare workers. I mean, truth to the matter is, I mean, in every part of the country, we do business over 130 countries around the world, and AstraZeneca is in touch with many of the healthcare providers around the world. And what we see is there's a lot of complexity in the healthcare systems. They are in the business to heal. They are in the business to help the patients. They are in the business to make a difference. However, sometimes the bureaucracy, the complexity, lack of funding is quite discouraging. It's quite frustrating. So I think for me, I'm an engineer by training, so I like to always simplify. So how do we simplify the way we work? How do we take waste out of the healthcare systems, right, such that it's simpler, easier, and more efficient, so that the healthcare workers, whether it's the doctors or the nurses or the surgeons, they are feeling more empowered to be making a difference, if you will. So I just touched on one simple point. To your questions around Africa, so for AstraZeneca, we've been in Africa for a long time. We have an initiative called Healthy Heart Africa, where we do pre-screening, early detection for hypertension. So to date, we've actually screened 9 million people, and you can imagine, hypertension controlled, a patient with hypertension that's controlled. It's a green patient, it's better for the communities, it's better for the economy, and our goal is how do we drive these early screening, early detection to help relieve burden and keep the patients out of the hospitals in the long run.
Yeah,
Robert.
Thanks for bringing these topics also together. I think it's really critical. Maybe from our perspective, first of all, there are thousands of hospitals that have pledged to become carbon neutral. And especially if you look at staff, it's very engaging for people. It's just a matter of getting organized and sometimes fighting. And as long as you fight for priority in a hospital and see it as a dichotomy or a contradiction, whether you should deliver better care or you focus on the environment, you're not going to solve it. So I think hospital administrators and leadership needs to understand that by addressing and, for instance, streamlining care pathways and other topics, you can deliver better care and reduce the environmental footprint. I think that's the mindset shift. On the access part, part of our mission statement is to make healthcare accessible to 300 million people in underserved communities. And I think that's a link also to what Farnas has been saying. So I think digital scalable care solutions will make a huge difference. One example is we have miniaturized ultrasound, portable ultrasound that makes huge impact in terms of material efficiency, energy efficiency, but most importantly, it makes it accessible. And we're working with the Bill and Melinda Gates Foundation to develop an AI-based protocol that allows scanning for high-risk pregnancies, for instance. Again, on a preventative side, really reducing the clinical burden, but also the environmental impact. So there are many fascinating examples. Happy to follow up. Thanks.
Thank you very much. Yeah, very briefly, if you would.
Yeah, I appreciate your question. Let me start with the basics. Education, training, that's essential for the healthcare workers. Certainly in our collaborative, work with all different health professions, look at what's minimally required for education and curriculum. But for frontline workers, I think you really need to be very clear, what are the actions you needed, and not try to make it very complex altogether. The next session, the public session I'm going to participate in, has Vanessa Carey, who's actually very much into the workforce issue, as you know, as a WHO envoy. So I think we're well aware of this big issue. It's not only the C-suite, it's actually what you provide people in the front. That's so critically important. I think on the Africa front, that's totally along the same line, where I keep thinking and hearing these amazing things that these companies are doing, but let's do it together. Yesterday we had a session on equity in healthcare delivery, and that was exactly the issue. While there's so many different examples of things which are being done, why not bring the companies and the countries, regions together to look at how do we pull out resources, how do we actually look at common learning and do it in a more impactful, coordinated way.
Thank you very much. There was a question over here previously. You could introduce yourself.
Yes, thanks so much. My name is Yoshi Nagamine from Gavi Vaccine Alliance. So thanks so much. Now, the trend towards and the push towards decarbonization in healthcare, it's very admirable. At the same time, I wonder, we just talked about in the activities in Africa, but also I'm very much interested in all the suppliers and pharma companies from Africa, whether this does not stifle the competitiveness of the pharma companies in developing countries, and whether de facto we do not exclude the pharma companies from these countries by making decarbonization as a criteria of procurement. Thank you.
Great question, thank you.
May I clarify the question? So your question's around how do we make sure that the pharma supply chains are not excluding certain parts of the world in terms of being a supplier for the healthcare supply chain? Is that?
How to make sure that we don't exclude the pharma companies from developing countries.
I see. I see. So if I can paraphrase the question is how do we make sure the healthcare supply chains do not exclude development countries that may not be able to meet the high bar of sustainability and environmental? I get it. So anyone who wants to start, or I can make a start on that?
Please make a start.
So I'm the head of supply chain for AstraZeneca, so I'm passionate about this topic. We spend billions of dollars each year procuring goods and services for both our manufacturing process into our medicines, our research processes, and also running our business globally. And we've been very clear, as Jens mentioned, significant part of emissions for AstraZeneca is in the Scope 3 space. So we started that journey already. Our ambition is by 2030, we would have reduced absolute Scope 3 emissions by 50%. Right? And then for the rest of it, we will become carbon negative. So it's a heavy lifting effort for us. So how are we going to do it? Are we going to do it by excluding suppliers who don't have the resources and don't have the means to meet the standards? Not exactly. So what we are doing effectively is we said, by 2025, 95% of our key suppliers needs to have science-based targets identified. They need to understand that having a science-based target is important as part of their business. We've segmented our suppliers. We know those suppliers who have the means, who have the resources to be compliant with the science-based target. We understand, and then on the other end of the spectrum, we also understand that there are suppliers who don't have the means. Their intent would be great, they want to, but they don't have the necessary resources and means to do that. With those set of suppliers, we're actually going to help our suppliers. So AstraZeneca will dispense effort and resources to help our key suppliers from diverse backgrounds to achieve their targets. That's not an excuse to not get there, but we will help, if you know what I mean. And then ultimately, by 2030 and beyond, we would need to be working with a set of suppliers that understands the importance of fighting climate change and climate crisis, and who understands the needs to be with science-based targets, if you will. So funding is element, resources an element. I think the culture, the motivation, and sort of the drive to be carbon neutral is also very important for my company.
Thank you very much. Would you like to also respond?
Yeah, I think in our supply chain, we are not in the pharma, but in the health tech space, of course, it is much more important to go beyond compliance and build capabilities, as I said, right? So, I mean, really sharing what we have learned with our suppliers, creating incentives also, for instance, working capital financing in line with aligning company strategies with decarbonization, getting people on the ground, inviting them. So there a lot of focus in supply chains over the past years, decades, have been very much on compliance and auditing. And I think we really need to go far beyond auditing by being honest, transparent, understanding what the issues and the challenges are, and working together and sharing this opportunity. And we are doing that, and that helps.
Great, thank you. And some final remarks from Dr. Zhao.
I mean, this is why we need the voice of supply chain, right? I attend a lot of meetings where there's certainly pharma, the device companies and care delivery, but not enough of supply chain. And our collaborative, we have lots of supply chain, the Alliance for Supply Chain and many others. I mean, I begin to learn about the fact you probably have about several hundred supply chains, so they need to be at the table knowing this is the direction we're going, and we need to give them an incentive to move that direction. Innovation is really needed. If you look at drones for delivery, right? I mean, there's happening everywhere in Africa that, in fact, we want to give innovation. That comes back to one of Fanaz's point, which is regulation. When I talk to supply chain, they say, we'd like to be more innovative. However, every time we change things, FDA comes in to say, yeah, did you meet this criteria, that criteria? So I make the same point again. It's got to be everybody at the same table to look at solutions together.
Thank you. Thank you. And I'm going to take one final question, either from online or in the room, before we wrap up, if we have any. One over here. Thank you, sir. You could introduce yourself.
Mike Hayes from KPMG. I lead our global climate and decarbonisation business. Much of the discussion is focused on decarbonising the health sector, and I'm really delighted Pam mentioned biomethane, one of the really great solutions, but that's not what I want to talk about now. I want to go right back to the very start. I have lived with the issue of climate risk over the last 10 years, and we have focused in climate risk on the physical risk of climate and particularly the financial risk. And I was just saying this to Maggie, who I just met, what I'm really hoping to do is that we bring health into the climate risk discussion. And the power of that, first of all, it's very real, and I think some of you articulated that at the very beginning, but it is going to help us get climate taken much more seriously than it is today. I was at COP, I met Robert at COP a couple of weeks ago, we're here. We're in the midst of people who get it, but bear in mind there are lots of other people who don't get it, who don't understand the seriousness of this, how real it is, as you pointed out, in developing countries. So I'm very much hoping that we can collectively really put the nexus between climate and health, and to explain to people that climate is going to cause a health crisis. So it's a commentary, but if anybody's any comments, but for me that is one of the most important messages that I think we need collectively, and it's great to see that the healthcare and climate people coming together to have this type of discussion.
Thanks very much, Michael. Robert, would you like to respond?
If I can react briefly to that, thanks, Michael. Vanessa Carey is not here. You already mentioned her. She's the climate envoy of the WHO, and she said recently we should stop measuring climate change in degrees Celsius. We should start talking and thinking about millions of people's lives saved. So I think this is exactly the nexus where climate change has been abstract for a very long time. It is here now, but in the healthcare sector, it gets a face, it gets tangible, and it gets people to act. And I think that comes squarely back to why we are sitting here together. So why should healthcare take the lead in climate mitigation? Because this is where the social effects are so visible. And as you said, Dr. Zhao, also healthcare professionals are trusted members of society. So if they stand up, if doctors are marching on these climate marches, that will really change the course of history.
Can I just add quickly? Just thank you, super thank you for saying that, because true to the matter, this is why we are all here for a lot of us, right? I mean, I think we have all the necessary data to kind of tell that story, to educate, to share. We don't do it enough, right? As Dr. Zhao mentioned, I mean, approximately 12 million people die of every year from air pollution and from extreme heat. And in the Lancet report last year, published fourth quarter of last year, it says if by 2050 we don't control the temperature rise by more than 1.5 degrees, if it goes up to 2 degrees versus pre-industrial levels, the number of extreme heat-related death will be increased by 370%. I mean, that's pretty scary. You just need to look at the data. The number of respiratory disease, COPD, for example, cancer. I mean, it's hard to say it's not related to climate change.
Thank you. Jens.
Yeah, the heading for this session is why healthcare must lead in climate mitigation, and you just gave a very strategic additional reason why healthcare must lead in climate change, and I think it's necessary also because from an instrumental point of view, climate change is something that is not very close to people. It's something that happens. It's a public good or a public problem up in the air, but health is super, of course, obviously close to us and something we can readily understand. And then I also think we even need to go beyond that and look at us as part of nature. In again answering your systemic question before, so.
Thank you.
Totally agree.
And Dr. Zhao, you opened our session as our first commentator. I think it's only fitting that you should bring us to a close as with your some closing remarks and some response to that last question.
Well, I think this is a wonderful session and the focus on healthcare, but I would say we need to go beyond healthcare to health as a whole. So it's not only the care delivery part of the equation, it's prevention, health as a whole, and I quite agree with the comments that you made. I think critically, if you think about this, is really thinking about how to make sure that this information known to the public. Even in my space in global health, there are not enough global health leaders. We're really into COVID-19 pandemic preparedness, and now increasingly there's a shift now of some global health leaders to start talking about climate, but not enough, right? We need to move everybody in this space into the recognition that climate is a real crisis, and we need everybody to work together.
Thank you very much. A fitting note to end the session on and a clear call to action. So thank you, everybody. Thank you to our panelists who have provided such valuable insights today. Thank you, Victor, Robert, Pam, Jens and Varnaz. Thank you, of course, to our audience here in the room in the SDG tent in Davos, and thank you to those online. I want to get you out of here into the cold to your next meetings. So it's my pleasure to have moderated this session this morning and wishing you a very productive Davos rest of week. Thank you very much.
Thank you. All right. It was a pleasure. And I'll see you.